Hey guys, so this is the NCLEX-RN 2019 ATI Comprehensive Review Series. So this is section 4D on pharmacology and medications. Here are the classes of nervous system medication: anti-anxiety, antidepressants, bipolar disorder medications, antipsychotics, ADHD medications, sedative, hypnotic medications, abstinence maintenance medications. Anti-anxiety. So these increase GABA to reduce anxiety. So these include benzodiazepines, buspirone, and antidepressants. Anti-anxieties are used for anxiety disorder, panic disorder, insomnia, alcohol withdrawal, and to induce anesthesia. Benzodiazepines. These generally end in am, pam, etc. You could think of like a girl named Pam who's always anxious, so you give her benzodiazepines. So alprazolam, chlordiazepoxide, diazepam, and lorazepam. Then goes buspirone. Then goes antidepressants. I'm not going to read them because we're going to go over on the next slide. Some side effects are CNS depressants, because that's exactly what the medication is doing. It's depressing the CNS. Paradoxical response is what the opposite of what you would think would happen. So it could be insomnia, they get excited, euphoria. Withdrawal. So you should know that withdrawal does not happen with buspirone, and there's a risk for abuse and overdose with the benzodiazepines. Other stuff, you should monitor the vitals, never stop abruptly, and avoid alcohol. Antidepressants. So they're divided into three groups. Or four groups, more like. Okay, SSRI and SNRI, we're going to combine in one group. Tricyclic and MAOI. So SSRI includes the first line. So that includes citalopram, fluoxetine, paroxetine, sertraline. And SNRIs includes the second line, duloxetine and venlafaxine. Side effects for SSRI and SNRI are weight gain, sexual dysfunction, fatigue, and drowsiness. You just think of all the stuff that a teenager would not want to have. They would not want weight gain or sexual dysfunction, etc. So other stuff you should know is no alcohol, don't discontinue this abruptly, monitor for serotonin syndrome for the first 72 hours. So the NCLEX likes to test on serotonin syndrome. So if they give you a question with SSRI and signs and symptoms of serotonin syndrome, you want to think that right away, and then you want to discontinue the medication. Serotonin syndrome, you're going to see agitation, confusion, hallucinations, all those type of stuff. Okay, now we go on to tricyclic. These include amitriptyline and imipramine. So these side effects are anticholinergic, so like we said, can see, can pee, can shit, and can spit. Orthostatic hypotension, cardiac dysrhythmias, and decreased seizure threshold. So I would remember cardiac dysrhythmias, so you remember tricyclic, like a cycle, so the heart goes through a cycle. It's contraindicated with patients with seizures because it decreases the seizure threshold. Alcohol, MAOIs, and St. John's wort. MAOIs, so these include isocarboxazid, trinicycloramine, and phenelzine. So these have a side effect of CNS stimulants, orthostatic hypotension, hypertensive crisis with tyramine, SSRI, and tricyclic. This you want to know. If you take any other antidepressants, you have a risk of a hypertensive crisis. So when you stop one, you want to wait 2 weeks. It's called a washout period, and then take another one. You should not have tyramine foods, so this includes a lot of foods like aged cheese, wines, like go look at the list. There's basically every food in there. You also don't want to take it with antihypertensive, a different antidepressants for someone with heart failure, CVA, or renal insufficiency. So for all the antidepressants, you want to know that there's a risk for suicide. As soon as they start taking it and they feel better, they have a risk for suicide because they actually could complete their plan. You want to take SSRIs in the morning because it could cause insomnia, and you want to give a patient the list of foods for MAOIs that they can't take. Bipolar disorder medications. So these produce neurochemical changes in the brain to control acute mania, depression, and incidence of suicide. The medication that you would use for bipolar is lithium. You should really know this. They like to test on it, and it has a very narrow therapeutic range. Its uses are for bipolar, alcohol use disorder, bulimia, and schizophrenia. Side effects, which could mean that you're having lithium toxicity, are GI distress, fine tremors, polyuria, hypothyroidism, and renal toxicity. You want to caution with the patient with renal dysfunction, heart disease, hyponatremia, and dehydration. Other stuff you should know, you want to monitor for a therapeutic level, which is 0.8 to 1.2. Effect begins 1 to 2 weeks after given, and it's given 1 to 3 times daily. It's given with food because of GI, and you want to watch the sodium levels because dehydration could cause lithium toxicity. Antipsychotics. So these include typical and atypical. The typical are the older ones, and atypical are the newer ones. Atypical has the more severe side effects, and atypical has side effects but not as severe. So typical includes haloperidol, fluphenazine, chlorpromazine. Side effects are sedation, EPS effects, anticholinergic, tardive dyskinesia, agranulocytosis, NMS, and seizures. Extraterminal effects are movements and muscle control problems. NMS is neuroleptic malignant syndrome, and this is a rare but life-threatening reaction to typical antipsychotics. You're going to see fever, muscle rigidity, altered mental status, and autonomic dysfunction. Atypical includes ariprazole, clozapine, olanzapine, quetiapine, and ziprasidone. Side effects for these are more endocrine type of side effects like weight gain, diabetes, dyslipidemia, orthostatic hypertension. It also has EPS, which is extrapyramidal effects, which are the movement and muscle control problems, but they're not as severe as the typical ones. You should just know, I wrote agranulocytosis, so this they like to test. So with clozapine, you're going to see agranulocytosis, so you want to monitor the white blood cell count, etc. Other stuff you should just monitor for the side effects, monitor the CBC count, and you want to stop if there's neuroleptic malignant syndrome. ADHD medication. So these include stimulants and non-stimulants. Stimulants, everything's going to go up. So side effects are going to be insomnia, headache, agitation, you're not going to be hungry, ab pain, etc. The medications for stimulants are amphetamines and dextroamphetamines. Hint to remember this is mean. Think of a child in school with ADHD and people are going to bully that kid, so they're going to be mean. Also, you want to give it in the morning and you don't want to stop it abruptly. There's a high potential for abuse. Then we go to non-stimulants. These include atomoxetine and guanfacine. The side effects are GI upset, insomnia, and mood swings. And basically what these ADHD medications do is that they increase the attention span, they reduce impulsivity and hyperactivity. Sedative and hypnotic medications. So these include benzodiazepines and other medications. So benzodiazepines are CNS depressants. So that's exactly what it's doing. It's depressing the CNS, called sedative or hypnotic. Benzodiazepam, so lorazepam, tamizepam, etc. A hint to remember this, you could think of a girl named Pam who's in school. What does she want to do in school? Sleep, just like everyone else. Some other medications are zolpidem, and the other one I've never seen. Its uses are for insomnia, someone who has difficulty going to sleep. You want to caution with other medications that depress the CNS system, and alcohol, because alcohol is a CNS depressant also. Side effects are amnesia, which is memory loss, respiratory depression, drowsiness, and dizziness. So think about it. All the side effects are stuff that are depressing. It's going to slow everything down. Other stuff you should know, you want to take it right before bed and avoid alcohol. Abstinence maintenance medications. So these include disulfiram and methadone. So disulfiram is given for alcohol, and methadone is given for opiates. Disulfiram, it causes unpleasant side effects if someone takes alcohol, like flushing, throbbing, respiratory depression, nausea, vomiting, chest pain, syncope, confusion, etc. So it's going to make you not take alcohol because you're going to have the side effects. And these effects could last from anywhere between 30 minutes to several hours. Other side effects from this medication is drowsiness, headache, metallic taste, hepatotoxicity. Other stuff you should know, you want to wait 12 hours after alcohol to start this medication. And you want to tell the patient what will happen if they do have alcohol. Like I just said before, the throbbing, the syncope, flushing, etc. Then the next medication is methadone. It's given for opioid. It reduces the withdrawal symptoms. Side effects are sedation, respiratory depression, paradoxical CNS excitation, which means that it's the opposite of what you would think it's trying to do. It's trying to slow everything down, and the opposite occurs. He gets excited. Contraindicated with patients with QT syndrome, severe asthma, respiratory disease, or history of head injury. Chronic neurological disorder medications. These include cholinesterase inhibitors, anti-Parkinson's, antiseizures, ophthalmologic medications, which are used for anti-glaucoma. Cholinesterase inhibitors. So these I don't really see a lot. I would just know neostigmine and the other medications I've never seen before. These are for myasthenia gravis. The side effects are slow heart rate, chest pain, weak pulse, you feel like you're passing out, urinating a lot, seizures, and trouble swallowing. Other stuff you should know is that you want to keep a diary of the side effects, you want to wear a med alert bracelet, and you want to watch out for cholinergic crisis. So what cholinesterase inhibitors do is that they cause improved transmission of nerve impulses. Antiparkinson. So this increases dopamine, so it minimizes the tremors and rigidity. The medications are benzotropine, carbidopa, and levodopa. So benzotropine, you might remember from the antipsychotics. If you have something that's EPS symptoms, then you would give that. EPS symptoms are the same type of symptoms as Parkinson's, like muscle tremors, etc. So side effects are muscle twitching, headache, dizziness, dark urine, and orthostatic hypertension. Other stuff you want to remember, you want to keep the medication away from light, moisture, and heat. If it's dark, you want to disregard it because it means that it's not potent. Contraindicated specifically with benzotropine, it's contraindicated with patients with narrow angle glaucoma, and you want to discontinue it 8 hours before anesthesia. Antiseizures. So what they do is that they slow the neuroactivity in the brain by blocking certain neurofiring channels. These include carbamazepine, gabapentin, phenobarbital, phenytoin, and valproic acid. Carbamazepine, the side effects are anemia, leukopenia, and Stevens-Johnson syndrome. It's contraindicated in bone marrow depression, bleeding disorders, and it decreases oral contraceptive and warfarin. So gabapentin side effects are headache, weight gain, CNS depressant. Phenobarbital side effects are drowsiness, hypertension, respiratory depression. It's contraindicated in someone with a substance use disorder. Phentoin, so they like to ask that one of the side effects are gingival hypertrophy, so that has to do with the gums getting bigger. And diplopia, drowsiness, hirsutism. And then goes valproic acid. It's contraindicated with liver disease, and in pregnancy some side effects are hepatotoxicity, tetragenic effects, and pancreatitis. So other stuff I would know that if there's a status epilepticus, you want to give diazepam or lorazepam, IV push, and then IV phentoin. A status epilepticus is a seizure for more than 5 minutes, or one after another. So what I would know from the slide, I would just know the names of the medications and that they are anti-seizures, and I would know that anti-seizures, they slow everything down, so you're going to have respiratory depression, CNS depressant signs, and stuff like that. And you should also know for phentoin, a side effect is gingival hypertrophy, and you should know that valproic acid is contraindicated in pregnancy. The Myalgic medication, anti-glaucoma. So these are medications that are used for your eye for glaucoma. These include levodopa, timolol, pilocarpine, and lantanzapros. Well, as you can see, a lot of them end in olol, so they're beta blockers. They interact with beta blockers, obviously, and calcium channel blockers. Side effects are the beta blockers, so bradycardia, heart failure, bronchospasm, and brown discoloration of the iris, and retinal detachment, which is an emergency. The other stuff you should know, you want to use sterile technique when handling the applicator. You want to hold pressure on the duct after instilling drops for 30 to 60 seconds, and you want to monitor the pulse. Medications for pain and inflammation. So these include NSAIDs and opioid analgesics. So you probably heard of a few of them before because they've been in a lot of other categories of medications that we use. So NSAIDs, I'm just going to say acetaminophen. So this is Tylenol. What it does is that it slows the production of prostaglandins in the CNS. So it's used for analgesics, which is like for pain, and it's an antipyretic, so it's used to reduce fever. Some side effects are nausea, vomiting, and if you use a long-term liver disease. You want to monitor the liver and kidney function, no more than 4,000 megagrams for 24 hours, and you give it based on the child's age and no more than 5 times a day. If someone overdoses, you want to give them acetylcysteine. So you should know that acetylcysteine is for overdose of acetaminophen. The opioid analgesics, what these do is that they bind to opioid receptors to alter the perception and emotional response to pain. These include fentanyl, hydromorphone, morphine sulfate, meperidine, codeine, and oxycodone. So these are used for pain and sedation. Side effects are orthostatic hypertension, constipation, urinary retention, blurred vision, respiratory depression, and abstinence syndrome. They're all anticholinergic effects. So just remember the mnemonic for anticholinergic: can see, can pee, can spit, and can shit. And then you'll help to remember these side effects. Some other stuff you should do, you want to monitor the vitals and watch for respiratory depression. So if they ever ask you a question on any opioids, it's probably going to be the answer you want to watch out is for respiratory depression. If someone overdoses on opioids, you want to give them naloxone. So for NSAIDs, which is acetaminophen, you want to give acetylcysteine for overdose, and for opioids, you want to give naloxone. And how would you know if someone overdosed on opioids? You would see respiratory depression. Reproductive system medications. So these include contraception, oxytocin, methotrexate, Localytics, antinatal steroids, and medication for postpartum. Contraceptive. So you're going to give contraception based on a lot of different factors. Their age, their religion, the amount of sexual partners they have. That's all going to vary. But here are some types. Rhythm, which basically that you're not taking anything, you just don't have sex during your fertile period times. It's very low reliability, but you're going to go based on your temperature, based on your cycle, etc. Then goes orally, which a lot of people take. It's just taking a pill every day. Some side effects are breast tenderness, bleeding, nausea, and vomiting, and you don't want to smoke while taking it. And then goes emergency. This is if you forgot to take it before, you want to take it within 72 hours after you have sex, and you want to repeat it 12 hours after another dose. What emergency is, it's basically giving you a larger than normal dose, so you're going to have the same side effects, just a little more side effects. So you can have nausea and vomiting, etc. Then goes cervical diaphragm. So this you want to give with Spermicide. Basically, it's fit by the doctor, and it has to be refit if someone had a baby or if they gained weight or lost weight. They want to put in 6 hours before sex and for 6 hours after sex. It goes Iud, which stands for intrauterine device. So the hormonal one, it lasts for 5 years. There's a copper one, it lasts for 10 years. It's not for people who have a history of pelvic inflammatory disease or someone with diabetes. What you want to do, you want to verify the string is in place and you want to monitor for infection. So the thing with IUDs, there's a risk for infection, which is very important. Some side effects are heavier periods, cramping, and infection. There are other ones not on this list. I'm just going to say right now that there is a condom. You want to use this with Spermicide. Condom protects against STDs. You want to apply and remove it correctly. Then goes spermicides, which you want to use with the barrier method like a condom. They come in all different forms, a gel, a cream, etc. You want to insert it 1 hour before intercourse. And then there's some other stuff I didn't really list right now, but there's a vaginal ring, which you want to place in the vagina every 3 weeks. It's usually one size fits most people. If it falls out, you want to rinse it and replace it within 3 hours. There's also a contraceptive patch. You want to replace it every 3 weeks also. You want to apply it to either your butt, your ab, your upper torso, or your upper arm. And then with the patch, your period is going to begin on week 4, which is the week that you don't have a patch on. Oxytocin. So these include cervical ripening and oxytocin. So cervical ripening are prostaglandins that cause cervical softening and preparation for cervical dilation and effacement. These include dinoprostin, cervical gel, misoprostol. Some side effects are nausea, headache, tremors, tension, warmth feeling over vaginal area, elevated temperature, and tachysystole. Contraindicated in patients with acute pelvic inflammatory disease, pelvic surgery, and abnormal fetal position. Some other stuff you want to know, you want to give, so as soon as you give that, you're going to have bed rest 2 hours, and you want to monitor for maternal vitals and fetal heart rate and maternal contractions. Then goes oxytocin. So oxytocin stimulates contractions to induce labor, or it's used to prevent postpartum hemorrhage. Its uses could be antepartum for a contraction stress test, intrapartum to induce or augment labor, or postpartum to promote uterine tone. Some side effects are intense contractions, uterine hyperstimulation, uterine rupture, and water intoxication. It's contraindicated with placental abnormalities, fetal malpresentation, previous uterine surgery, and fetal distress. Some other stuff you want to give it via secondary infusion, and you want to monitor maternal vitals and fetal heart rate. If there is signs of uterine hyperstimulation, you want to give oxygen via face mask at 10 liters, and you want to discontinue. So what I would know from this page, because this page is very important, I would know the names of the medications, and you should know that oxytocin medications, they stimulate the uterus to contract. So if there's too much stimulation, that's really bad, so you want to stop it. And if there's anything that could be abnormal with the baby, you don't want to stimulate contractions. You don't want the baby to come. If the fetal's in the wrong position or there's fetal distress, then you want to stop it right away. And you should know that the side effect, the major one that you're looking for, is tachysystole, which means more than 5 contractions in 10 minutes over a 30-minute period. Methajonovian. So what this does is that it acts on the uterine muscle to stimulate contraction. It's known as Methadone. Some side effects are vasoconstriction, hypertension, and headache. These are important side effects you have to know. If you know the side effects, you know who it's contraindicated in. Patients with hypertension, preeclampsia, heart disease, sepsis, hepatic and renal impairment. Some other stuff you want to know, you want to monitor the blood pressure, assess uterine bleeding, and tone. Localytics. These act on the uterine muscles to stop contractions. These are used when you want to stop preterm labor. These include terbutaline, nifedipine, and magnesium sulfate. For terbutaline, side effects are nervousness, hyperglycemia, headache, nausea, vomiting, palpitations, chest pain, and pulmonary edema. Some other stuff you should know is that you do not want to give it if the pulse is more than 130 or if someone has chest pains. The antidote, beta blockers. The next one is nifedipine, which side effects are hypotension, nausea, headache, and flushing. You do not want to give this with magnesium sulfate because magnesium sulfate is also a tocolytic. Magnesium sulfate. The side effects are diminished deep tendon reflexes, decreased urine output, pulmonary edema, respiratory depression, warmth, and flushing. Some other stuff you should know is that you want to monitor the deep tendon reflex. Therapeutic level is 4 to 8. You should remember that. And you want to give it via infusion pump. You want to use an indwelling catheter to monitor urinary elimination. If you go over the therapeutic levels of 4 to 8 and you hit toxicity, you want to give calcium gluconate. Some other stuff you want to know is to monitor contractions, fetal heart rate, and vitals. Antenatal steroids stimulate the production of surfactant in a fetus between 24 to 34 weeks. So you should know these weeks. 24 to 34 weeks is when you would use it. The medication is called Methadone, and its uses are to promote fetal lung maturity in preterm labor when delivery is very likely. Some side effects are fluid retention, high blood pressure, maternal hyperglycemia, and transient increase in white blood cells. Other stuff you should know, you want to give it 2 doses, IM, 24 hours apart. Postpartum medication. So these include Rho-D immunoglobulin, known as Rogam, and Varicella Vaccine. So Rogam, what it does is that it suppresses the stimulation of active immunity by Rh-positive foreign RBCs that enter maternal circulation at the time of delivery. So it's used for Rh factor incompatibility between the mother and the baby. So what you have to do is you have to confirm that the mother is Rh negative. A mom is Rh negative, that's when you would have to give the ROGAM. Some other stuff, you know that you're going to be giving it within 72 hours after birth. So again, if this mother is Rh negative and the baby is positive and the Coombs test is negative, it can be given injection at 28 weeks gestation or at any event that maternal blood commix. An event that you would give ROGAM that maternal blood commix would be from a miscarriage, ectopic pregnancy, induced abortion, amniocentesis, an abdominal trauma like a car accident. And then the next type of postpartum medication is Varicella Vaccine. So this is given postpartum if the mother was not immune to it before. So you want to use a reliable form of contraception and avoid pregnancy for 3 months. Complementary and alternative therapies. So these I wouldn't really know in depth. You barely get any questions, but you do get a few questions, and most of the questions are to know what they're used for and the interaction. So that's what I wrote here. So we'll start off with Solpimento. It's used for BPH, benign prostate hyperplasia, and it interacts with anticoagulants. That includes warfarin, heparin, etc. Then the next one goes Valerian Root, and these are used for menstrual cramps, migraines, insomnia, and this interacts with benzodiazepines and barbiturates. The next one is St. John's wort, and it's used for depression. This they like to ask for, seasonal affective disorder, and anxiety. It interacts with a lot of stuff. So just know that it interacts with a lot of stuff like oral contraceptive, cyclosporin, warfarin, antivirals, digoxin, calcium channel blockers, and antidepressants. So the next one is Shantia, and that one's used for cold. It's for like immune system type of things, wound healing, and that interacts with immunosuppressants, alprazolam, calcium channel blockers, and protease inhibitors. Garlic, it's a vasodilator. It lowers the LDL and triglycerides and it higher the HDL. It interacts with NSAIDs, warfarin, heparin, and cyclosporin. So think of all the coagulation stuff like NSAID and warfarin, and that's what it's going to interact with. So ginger root is used for vertigo, nausea, GI problems, motion sickness, and rheumatoid arthritis. Do not use it in pregnancy, and it interacts with NSAIDs, warfarin, heparin, and don't use it if you have diabetes. Ginkgo, it's used for dementia, memory loss, and for pain. It interacts with MAOIs, anticoagulants, and antiplatelets. Glucosamide, it's used for osteoarthritis and joint health. It interacts with antidiabetic agents like insulin, anticoagulants like NSAIDs and warfarin, and don't use it if you're allergic to shellfish. Omega-3 fatty acids are to maintain cardiac health and triglycerides. Melatonin is for insomnia and jet lag. It interacts with beta blockers, warfarin, steroids, and don't use it in pregnancy. You should just know about all the herbs. They are not regulated by the FDA and then interact with many medications. Okay, so that's the end of PART4D, and that's the end of the pharmacology part of it. Now we're going to go on in Part 5 to Fundamentals of Nursing. Stay tuned and like and subscribe.